Congressman Price, the United States of America is the only major country on earth that does not guarantee health care to all people as a right. Canada does it. Every major country in Europe does it. Do you believe that health care is a right of all Americans, whether they're rich or they're poor? Should people, because they are Americans, be able to go to the doctor when they need to, be able to go into a hospital because they are Americans?
Yes, we're a compassionate society.
No, we are not a compassionate society. In terms of our relationship to poor and working people, our record is worse than virtually any other country on earth. We have the highest rate of childhood poverty of any other major country on earth, and half of our senior older workers have nothing set aside for retirement. So I don't think compared to other countries we are particularly compassionate. But my question is, in Canada, in other countries, all people have the right to get health care. Do you believe we should move in that direction?
If you want to talk about other countries' health care systems, there are consequences to the decisions that they've made, just as there are consequences to the decision that we've made. I believe, and I look forward to working with you to make certain that every single American has access to the highest quality care and coverage that is possible.
Has access to does not mean that they are guaranteed health care. I have access to buying a $10 million home. I don't have the money to do that.
And that's why we believe it's appropriate to put in place a system that gives every person the financial feasibility to be able to purchase the coverage that they want for themselves and for their family. Again, not what the government forces them to buy.
Yeah, but if they don't have any, well, that's a longer story. Thank you very much.
It's also been insinuated that America is this horrible, rotten place, you know, that we don't have compassion, and I guess by extension the physicians don't. Well, as you worked as an emergency room physician or as you worked as a physician, did you always agree as part of your engagement with the hospital to treat all comers regardless of whether they had an ability to pay?
It's one of the things we pride ourselves upon, and that is that anybody that showed up in need of care was provided that care, and that was true not only in our residency but in our private orthopedic practice as well.
And it's interesting that those who say we have no compassion, you know, extol the virtues of socialism. And you look at a country like Venezuela with great resources and an utter disaster where people can't eat, devolving into violence. And, you know, I think it is important that we do have a debate ultimately in our country between socialism and communism and America and capitalism. One of the things that's extraordinary about our country is that just 2 years ago, passionate society, and I think often this was misplaced in sort of the wonky numbers of this number and that number within healthcare. How much we do help each other. Not only do we help each other within our country, I'll bet you half the physicians in my community in Bowling Green have gone on international trips and done international charity work. And all that is lost in saying that we're this heartless, terrible country. And I would just argue the opposite. I think the greatness of our country and the greatness of the compassion of our country, we give away more than the gross domestic product of most of these socialized countries around the world. So I think it is important.